Assalamu alaikum doctors, welcome to my YouTube channel MBBS and BDS lectures. Today is the fifth video of repeat revision of course of community dentistry, which is very important for NLE, MDS, NBD as well as for BDS students. In this video we will discuss about educational aids used in health education. In last NLE exam March attempt from audio aids and per radio the MCQs was come. Now in this video we will discuss about educational aids used in health education like audio aids, visual aids and combination of audio and visual aids. Next is the health education for large masses, means general public awareness, and here there are 9 methods we will discuss, because from radio, television in March and early attempt MCQs was come. Now educational aids used in health education are the audio aids, visual aids and combination of audio and visual aids, which is the audio visual aids. Now in audio aids most commonly used are megaphones, microphones, amplifier which enhance the sound, radio, tape recorder, gramophones record and discs. They are useful in reproducing any kind of words spoken and also help in repeating the same. Can be used for entertainment and mass communication. Now remember, in audio aids these 6 are come. You should remember this name for MCQs. Next is the visual aids. In visual aids there are now visual aids help people to understand better. They can be classified as visual aids are of 3 types: projected aids, non-projected aids, other aids. And projected aids are that which need projection. Projector, like during multimedia classes we have projector to place the light on slides and walls to play the slides. These mean the aids in visual which required a projector light are projected aids, which do not require light are non-projected aids. And next is the other aids. In projected aids, these needs projection from a source onto the screen. For example, films or cinemas use projected aids, film strips, slides, overhead projectors, EPDS scopes. Next is the transparencies, bioscopes, silent films, video cassettes. These are the projected aids which required projector. Advantages of these are real life situation can be projected, self-explanatory, create special interest, a situational effect can be shown and can leave a lasting impression in viewer minds. Second is the non-projected aids. Do not require any projection. For example, blackboard, pictures, leaflets, posters, charts, exhibits, models, specimens, photographs, cartoons, graphs, brochures, booklets, pamphlets, flannel graph, flashcards. These are the non-projected aids. Third is the other aids like puppet shows, dramas, folk dance, folk songs. You should remember in projected aids which names are come, in non-projected aids which names are come, in other which names are come. Now come to the combined audio visual aids. This is a combination of audio and video. The visual and audio. The advantages of this is the advantage of this is both vision and sound can be combined together to have a better presentation. For example, television use both, film cinemas use both, slide tape combination, video cassette player and record, and multimedia computers. They are come in the combined audio visual aids. Now come to the health education for large masses general public. Mean health education, how we spread health education for large masses general public. Mass media is useful in transmitting message to people in large number, millions, even from the remotest places. It is an effective method of health education for the whole community. It is one-way communication. Mass media alone is inadequate in changing the human behavior, but will more effective with other methods. Now in health education for large masses general public, there are Number one is the television. It is most popular of all media. It's not only effective in creating awareness but also have influence on people and introducing new way to life. It is one-way communication. It can only be an aid to teaching, cannot cover all aspects of learning. It covers large number of people and cater to all group of people. What are the disadvantages? High cost of TV sets and not accessible by all people and is one-way communication. Second is the radio. In developing countries, radio is more popular than TV. They can reach illiterate population and also accessible to all socio-economic groups. Health information can be conveyed in the form of talks, plays, questions and answer session, quiz, program, etc. Third is the internet. This is a fast growing communication media and has a large potential to become a major health education tool. This is computer based communication system. This is vast communication through direct and instant communication by means of emails, discussion forum and other online facilities. Next is the newspaper. Newspaper play an important role in a mass communication. They represent all form of literature and in most common languages. They are quite economically and easily accessible. Unfortunately, health problem have a little of value to newspaper. Disadvantages of this is health information will not reach to illiterate people. Next is the printed material. Magazine, pamphlet, booklet and handout have long been in use for health communication. They should be presented in simple language. They can be produced in bulk for very little cost. Maximum matter about a particular health problem is explained in detail. Now the television is the most popular and costly, and radio is the important points in each. Radio is developing countries is more popular than TV, and internet is a fast growing communication media, and newspaper is economical and printed material also economical. Next is the direct mailing. It is a new innovation in health education in India. Mainly main aim of this is to reach remote areas of country with printed material on the family planning, immunization, nutrition. These are mailed to the village leaders, illiterate people, bodies to distribute it to their community people. Seventh is the new innovation in health education is the direct mailing. Next is the poster, billboards and sign. They are generally used for mass education by displaying it in public places like railway station, bus station, multiplexes, commercial complexes, streets, hospital and health center. Message should be simple, artistic and should catch the eye and create awareness. Right matter should be displayed on right time. During epidemic of viral hepatitis, material should be on viral jaundice and not on other disease. The material should be changed frequently or it will lose their effect. Like poster of corona now time, no entry without mask. Health, museum and exhibition. These should be properly arranged to attract large number of people. Advantage is there is a personal communication through worker who have exhibit the materials. Doubt can be classified directly by presenting variety of ideas. They do increase knowledge and awareness. Next is the folk media. Health education is not only by electronic media and other media but also by indigenous media like kirtan, katha, folk song, dances, dramas, puppet song, like in folk media there is one poem, I think, Joni Joni yes papa eating sugar no papa, I think. The Muslim community have their own they eating sugar no papa, I think there is also awareness. The Muslim country have their own traditional folk like ghazals, qawwali, etc. This is all about educational aids used in health education. Now today our topic is complete. If you like my video, press the like button and share this video with your friends. If you are new to my channel, subscribe my channel by pressing the red subscribe button and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.